Myself, I'm Brooke with Dentsply. I am your local hygiene rep. So what we're going to go over today is like an infection control course that I typically do in people's private practice offices. I'm just going to make it a little bit more broader for the school system, but all the laws are the laws, so it doesn't really matter where we're kind of talking. This is John Dugan. He's the regional manager, so he's here to be my Vanna. He doesn't like that role, but I told him he has to be. So we have no PowerPoint, so don't bother looking over there. I will get very nervous if there's PowerPoint, so it's much better if we just kind of talk to each other. So throughout the course, I'm going to ask you guys lots of questions and kind of get you to interact a little bit more, just because it makes it a little bit more fun for this, and you get something out of it that way. Everybody that needs the C credits, will get free. All the information is in there. You just have to look in the back section. There's how to go online and take the test. And then my phone number and my email is on there. So if you have any questions or anything, you can just call me, text me, email me. Yeah, I got the whole packets full. So I guess I can leave them over here. And then if other people need them, they could just take them. Do you guys have like a person that's overall like in charge of the OSHA infection control stuff? You, okay. So sometimes I'm gonna be like looking directly at you. Okay, good. Because I get like blank stares from other people, and then I don't really, got to focus on somebody to get the answer. I'll take the phone. Do you mind if I just shut the door and then we can kind of start? Okay. Just because I'm gonna get distracted by what's going on out there. Okay, so what we're going to do today is basically do an overall infection prevention course where we focus on understanding the governing bodies. So there's a lot of different governing bodies, and there's some confusion of who covers what and what is important to certain governing body groups. Then we'll go over how everybody sets up their room for the day, how they clean up their room, how the sterilization area works, how we do suction lines and water, and then personal protective equipment. So we want to basically make sure that we're kind of covering everything that the governing bodies want you to be aware of, okay? So that's right there. Okay, I already gave you one. Okay. So with that being said, let's get started. So test question right off the start. OSHA. Who is OSHA? Anybody know? You got to speak out. Federal government. And they're concerned about safety of the employee. So they don't really care too much about the employer. They only care about making sure that the employees within the practice or within the school are kept in a safe working environment, okay? So they're mostly concerned about protecting so that nobody gets injured while they're at work, okay? So the same governing body that would go to a construction site or would go to Home Depot or anything would be the same people that would come to the school or to your private practice to make sure that you guys are kept in a safe working environment. Does that make sense? Okay, and then the next governing body is the CDC. Anybody know who that is? Center for Disease Control. Who do they care about? Everybody? Everybody, because they're trying to prevent the spread of disease, right? So they want to basically make sure that the world is kept safe and that there's preventing of diseases that way. Does that make sense? Mm-hmm. Okay, and then the only other governing body that's kind of relevant to you guys is the EPA. That's the Environmental Protection Agency. They're mostly concerned with X-ray units and amalgam separators and water lines. Those are kind of their main focus, okay? Have you guys recently done an OSHA course or an infection controls course recently? Recently? Okay. So basically, OSHA has had some changes that they, are focused on. They've had some changes to their labeling system, and they basically made a lot of updates in 2016, as did the CDC, okay? So have you guys ever seen this document here? This is the CDC's document. So in 2002, the CDC had come out with their original documents that basically kind of, it's not in that packet. Yeah, everybody does that. It basically went over everything that you needed to do according to the CDC, but nobody really read it. So there's a question there. Everybody, there's the CDC. They put out these regulations that everybody should follow. Are they recommendations, guidelines, or law?
CDC recommendations.
Okay, that's where the misinformation is going. They're actually law. So in the state of New Jersey, it basically says on your license that I will follow all OSHA guidelines and I will follow all CDC guidelines according to law. So with your licenses, that's where it's kind of attained to, okay? So everybody always kind of knew that whatever OSHA said, we had to follow OSHA, but nobody was really under the understanding when it came to the CDC. They just said, oh, those would be nice things that we should follow, but not according to your license. In the state of New Jersey, the bare minimum that they tell you for your license is that you have to follow the CDC guidelines. In other states, you have to adhere to different standards that are much larger than what the CDC says. Does that make sense? So you can have all of those three people come into your office. You can have OSHA come in, you can have this somebody that would represent the CDC, or you can have the EPA. So if OSHA came in, they would mostly be coming in because there was an alert to them that somebody had injured themselves, or a disgruntled patient or a disgruntled employee basically told them, you should go see this because this happened. They don't necessarily always come because a disgruntled patient or employee come, but they could come. With that being said, there's no such thing as a CDC officer. There's no CDC officer that's going to come into your office. Those people don't exist. Who would come into your office is the New Jersey State Board. We don't really want the New Jersey State Board to come into our office, right? If they will come in for the most innocent of reasons too. So like you guys have to renew your licenses and you were filling out, you're on the line, you're checking yes, no, and all those check boxes, and you checked yes when you were supposed to check no. And you checked that you were a convicted felon or that you use recreational drugs. It happens all of the time. Every time I do this, I have somebody say, oh, that happened. It will basically alert the state, and they will send an officer to the office, okay? And when that officer comes to the office, they'll basically be like, hey, can I speak with Faith's in front of me, so she's getting targeted. Can I speak with Faith? We need to go over our license, but since we're here, we're gonna do an infection control inspection. And during that infection control inspection, we're going to be making sure that we're following all these guidelines. So that is where we're going to kind of focus on these guidelines, because this is some of the changes that you might necessarily know about or thought that they would have been suggestions before, but they're actually law. Does that make sense? So with that being said, the OSHA officer comes in or the New Jersey State Board officer comes in and they will give you a report, right? And on this report, you can have 5 violations or you can have 1,000 violations or somewhere in between. And it's basically up to the officer of how they proceed. If you have 5 violations, they'll basically say, okay, you know, get these done by October 15th, we're good. Or they can say, we're not good. This is too many violations. Your office, your school is now shut down, okay? And everybody's licenses associated with that practice is then shut down. So any doctor, any assistant, any hygienist that has a license associated with the practices is then suspended. Does that make sense? You didn't, nobody, I get the same reaction every single time I do that, because it was a little, this has been reality for a very long time, but there's been a little bit of a lax in priority when it comes to infection control, which is no longer the case. You will notice if you go online that there's reports of all the different doctors and assistants that have had their licenses suspended. And it's happening so frequently that people are kind of surprised by it. So if the OSHA officer comes in or the New Jersey State Board come in, New Jersey State Board is concerned with the CDC but can implement OSHA. OSHA is concerned about OSHA but can implement the CDC. They kind of talk to each other and they are all basically in control of your licenses, okay? So if you were to lose your license or your license be suspended, you have to go in front of the New Jersey State Board to basically get your license back. I don't know if you have any free time and you wanted to YouTube having to get your license back. you basically have to sit in front of a room and explain yourself of giving your reasons of how and why you lost your license and how you are going to basically go about getting it back. It's not exactly a conversation that I would want to have, but just make sure that you're aware. People really always thought it was the doctor and it was always the doctor's control, but it's not, because sometimes the doctor will say, hey, staff, do this, and the staff didn't listen, and then the staff would be like, hey, doctor, do this, and the doctor didn't listen. So this basically says, it doesn't matter about what your opinion is or your opinion is, this is the law. You have to follow the law according to what we say. Does that make sense? All right, so, and then the EPA is like the nice, like, come on in. They're not going to fine you. They're super nice and easy. So they're just making sure that you're in regulations with everything. But what we're going to focus mostly on today is understanding what the CDC says. So they've made this revision in 2016 that basically made it doable and able for you guys to understand and comprehend and follow. When before it was this big, it's a lot smaller, and there's checklists in the back to basically see how far off or on your compliance is, okay? So with that being said, we're gonna kind of get started on your everyday life of how you guys do things. And I have no real full understanding of how, I'm just kind of speaking as if it was a general office, but we can kind of make adjustments for the school setting as we go, if that's okay. So ideally, this is what the CDC says that how they want your room to be set up, and I'm going to tell you how to do it, and then you guys can tell me how far off or how far on I'm on with that, okay? So when I walk into that area of where your school setting is, it's basically all those countertops should be as clear as possible. There should not be a whole bunch of clutter on the countertops at all, okay? Then we need to have a tray, and on that tray would be the setup of what we're going to be using for the patient. So in your case, you would have a basic setup in a sealed pouch. Then you would have, you know, your disposable items, your air water syringe tip, your suction, your prophy angle, your prophy paste, everything that you're going to be using for the patient sitting on this tray. So that includes prophy handpiece, basic setup, and all disposables sitting on this tray in a sealed pouch when the patient sits down in the room. Nothing should be set up in any of its places on the chair prior to the patient's arrival. Typically what I'm seeing now is basic setup is still in a sealed pouch, but your disposable items, I only have an air water syringe tip, but your disposable items are already set up, and people have just their handpiece set up. Is that what you guys are doing now?
Yes,
No.
with barriers, with barriers,
It's pre-set up,
pre-set
but
up,
everything's got barriers on it.
barriers. up.
Okay,
Listerine is not sitting there, it's on the counter.
okay,
We don't put the pouch, we have a cassette.
Okay.
On the bracket table, because it's not clean. They put it on the counter, and then in front of the patient, it's dropped out onto the tray.
okay. So you have the cassette in a pouch.
Yes.
Okay, okay,
But then the handpiece, because there's multiple visits, we used a handpiece like the last visit with the prophy paste and.
Oh, so you're saying for your patients that come in, it's not always using a handpiece, but when they're coming in,
Always finish the patient in one visit.
in one
so
setting,
we-
set it up. Okay. So then the handpiece should never be living on your chair. Typically when I see people, they just have this living there. This should never be living here, okay? Ideally, if we put our disposables on our tray and then put them out, it gives the presence of being cleaner, and then it's less work for you guys. Barrier tape is not necessarily something that the CDC or OSHA says that you have to do. Barrier tape is typically just for the protecting of the equipment and not necessarily an infection control thing. So the whole point is to not have to be wiping things down 100 times. But if you want to have it with this, you can, that's not against anything. It's just kind of more steps for you guys to take. Does that make sense, what I'm saying?
And barrier is all infection control, especially like on a saliva ejector when you have to move the dial. I
Yeah.
find it,
But on my ultrasonic and my
Yeah.
suction, I use a cover, and I don't mind if I have to wipe everything anyway.
we do.
Well, you're wiping it anyway, and that's kind of the point. If you're, that's just doing double, it's double, but it's fine. That's what I'm saying. There's nobody saying that you can't do it. Nobody's telling you that you have to do it either. Does that make
A
sense?
lot of offices don't.
Yeah.
I'm always shocked.
It's because it's basically creating more work. You're wiping it anyway, and you're protecting it, so you're doing double, but
Right.
I mean, there's no harm in that. But you guys do have everything sealed still, so that's the part that we're okay with. And are we sealing when we are using this, is this sealed and then opened in front of for each patient? Or is this reused for each patient?
Sterilized.
Okay, sterilized in between each patient and kept in a sealed?
Well,
Okay,
they may put it out, if they're setting up, they know they're polished, they may have it already attached to the unit with a barrier over that and the Profi cup sticking out of the
Okay.
barrier.
Something with the paper on this, the Profi angle, you know.
yeah, and that's what I find typically in a lot of private practice offices is that if they are pouching it, they will put the bag on top of it, but that's not sterilized anymore. So you have to keep that in a sealed pouch until it's open in front of the patient. So this subject in particular has been a very hot subject in private practice offices, because when this law came out, everybody was, if you pretend this is a high-speed section, typically the only offices that were doing, they were sterilizing their high-speed suction, but this law basically that came out in 2016 specifically calls out the words, if it can be removed from the chair, it has to be removed from the chair and sterilized between each patient. So high speeds were fine. It's the low speeds and the Profi handpieces that private practice offices are really trying to wrap their heads around, and that it's not just the nose cone part. And for the low speed and for Profi, it's because this twists off and is removable, it has to be removed and sterilized. So that's a big concept that people are trying to kind of wrap their heads around now. It also falls insofar as to say with the Cavitron, on your Cavitrons, these things are removable, and because they are removable, they have to be removed and sterilized between each patient. Were you aware of that part?
Well, we used to do that.
Where?
Okay.
And every time the students put them on, so many times they were actually breaking them because you have to line them up.
Mm-hmm.
So we went away from that and they put a barrier over it now,
Okay.
right?
Yeah. Technically, that's not in compliance with what the law is saying. Sorry, I'm going to make legs. Sorry. Because they kind of, I get where you're saying, but because it's a law is a law is a law, I just have to tell you what the law says. Because it can be removed, so you basically are putting this in here. This part is obviously being taken off, but this part is removable, and because this is going into the patient's mouth, it has to be removed and sterilized between each patient. So I think that, because you guys are like teaching, you have to teach everybody the correct ways and part of the law of it, and that would be to be in compliance with it, we would need to be sterilizing these and these between each patient. Make sense? In a lot of the private practices, we've been showing the Freedom handpiece in that it makes it easier. So you're not oiling, purging, pouching this. We are removing this outer sheath and we're sterilizing these metal sheaths. We're just popping this off and sterilizing these as opposed to running the motor through the handpiece. Have you guys seen these? I can pass this around for you guys to see, but basically it makes a lot of offices more comfortable because they know they're not burning out the motors and that there's nothing you can really do to a metal sheath in order to ruin it. It's a lot more cost effective too than having to purchase multiples of these air-driven ones. Here, you're in charge. Vanna, step in.
So much pressure.
So does everybody understand setup? So minimally covered as possible. You guys do have ultrasonics in each of your rooms. What's the story with that? They should be going because by them being in your room, those are not in a central sterilization area. So if an officer is to come in, show me your central sterilization area, that would be where your ultrasonic is. It would, no cleaning processes happen in operatories. Okay, so there should never be ultrasonics. There should never be any sort of cold sterile soaks. Shouldn't be anything in your operatory that you are working in. So that's something that you guys are working on doing, removing. Do you want mouths? Here.
Oh, sorry.
I know, I was like, don't use you're gonna hurt yourself if you do that. It's gonna hurt.
We're in the midst of waiting for our Miele dishwasher to come.
Okay, oh, because you have cassettes, right?
Any moment.
Any minute now?
Yeah.
We're holding our breath.
We are very well aware that that is not.
Do you not have an ultrasonic in your sterilization area?
We don't.
No, just the individuals that you see in each cubicle.
Okay. So, that's like an,
You don't need to say.
I was like, I don't know what to say.
We've been asking for a renovation for 10 years.
Yeah.
Because we're not up to standard.
Yeah, yeah.
It happened.
Okay, so you're aware. Do you have any sort of cold soaks or anything in your rooms? Okay, so when they are, so you guys are, let's pretend you're done. We've opened up all of our pouches, we've done our work, and then we're kind of done with our patients. Are we using everything disposable? Are we using disposable air water syringe tips, disposable suctions, disposable everything else that we're supposed to be using? Okay. So then when we're done with our patient, we're throwing all the disposables away in the room. And then we're putting our metal instruments into the ultrasonic. Right? Okay. So do we have heavy duty utility gloves in there? Are we scrubbing anything?
No.
Who tells you can't scrub anything? What governing body? Test question again.
Would that be OSHA?
That would be OSHA. That would be OSHA because we basically want to prevent the spread of disease, right? And if I said with the hand pieces that you need to sterilize your hand pieces between each patient, what governing body tells you you have to do that? CDC, right? Because this would spread disease and the other one could injure you. I just like to make sure people understand what people really focus on and what really people care about. Okay, so we put all of our instruments into the ultrasonic. So is the ultrasonic running during when a patient is in there? No. Okay, good. So you wait till it's like filled and then turn it on when?
Just one cassette. This one.
Oh, one cassette, okay.
Each
Oh, because
cubicle
each one
has
has a cassette, okay.
One cassette.
And how long is an ultrasonic cycle?
10 to 12 minutes, 12 for cassettes.
Okay, yeah, I would definitely say 12 because they recommend 12 to 18 minutes with 15 minutes being standard. So I would say 12 should be your minimum. If we could have it on longer, that'd probably be a little bit better. But you also don't want it to be running when there's any patients in that room, right?
What about full uppers when we do the beaker?
Dentures,
Dentures.
in the unit, removable.
We put that in a beaker in there. That's probably a no-no too.
Oh, sealed in plastic.
But then you don't have a
Just that.
cover on it then?
We do on half of it.
On half of it, but not where the beaker part is.
Correct.
Yeah.
think it just covers, but still.
You know the answer. There really it shouldn't be in your room, so it shouldn't be on, because then it's basically kind of running throughout the air.
Yeah.
So, yes. Are we changing our ultrasonic solution every?
Once a week, they don't use it every single day in the beginning. We change it one Friday, drain it and fill it on Monday.
Okay, how often are you using it?
We're using it probably 4 times during the week. A patient on Monday morning, Monday afternoon, well, maybe more because of freshmen. Maybe 6 cassettes go in there across the span of the week.
Okay,
So it's not like
Less
every
than a
hour
full
patient.
day of in private practice.
yeah. Oh, did you think I said something? So the answer is every day, and it's emptied at night and left emptied overnight and then refilled in the morning. They don't really make it, like I've had the discussions with private practices and when they've said, we've only saw one person a day, so we don't have to change our solution. It's not really the case. Every day is supposed to be emptied and drained. I use the analogy a lot of like if you took a bloody bath today and just because you only had a little bit of blood on you, you're gonna like leave it for tomorrow and then take another bath tomorrow and then another. It's kind of a gross analogy, but it's also slightly realistic. So technically you have to be changing it every day and leaving it emptied overnight and then refilling it the next morning.
But the reason for the ultrasonic is not to sterilize instrument, to just
Remove physical debris.
Go to the sterilization.
Yeah.
I don't know I mean, what's,
The point.
yeah.
It is the whole design and purpose of an ultrasonic is to remove physical debris so that nobody is ever hand scrubbing anything. But the solution in which you're diluting it in is not really effective if you're leaving it there for a week at a time. It would be essentially like if you're just putting it into water and putting it in.
Just putting it into water, if it's mechanical removal.
The recommendations in the guidelines say you have to use an enzymatic cleaner or a general purpose cleaner in order to take off that debris, to remove the blood and to remove. Typically, if you do studies, if you've seen the studies where they put it up against water and they put it up, they do studies, against water or against, all different kinds of solutions, tablets versus liquid versus everything, and they'll show you the difference in which the physical debris comes off and what it does to the instruments and protecting the instruments along the way. If you are, putting, a lot of people are like, oh, I just put Cavicide in there, or if I'll just put water in there, it really actually, if you look over time, it ruins your instruments.
If we switch to enzymatic spray, do we have to use an ultrasonic?
Yeah.
You still need an ultrasonic even if you have the spray treatment?
Yeah, so the spray treatment is designed as a pre-soak. So the whole point of that spray would be prior to you putting in. So say you get your dishwasher, they would recommend for you to spray your instruments in that cassette prior to going to the central sterilization area so that it would go into the ultrasonic. It's only meant for a pre-soak and not meant in replacement of.
But could you spray in the cubicle?
Yeah.
So they don't have to bring it to central supply and then have them spray and sit. They could do it chair side.
And then you would just keep your dirty instruments in the room?
No, then they would bring them to sterilization. Or should they just bring dirty cassettes straight to sterilization and have sterilization spray and then spraying on them?
Typically, everything for that should be done in central sterilization. But, progress, I always say progress, so that would be a step in the right direction. But yeah, it's only meant for a pre-soak so that nothing hardens. So a lot of people, say, oh, it's not going to be running until later on in the day, and then there's hardened blood on it. The whole point of the enzymatic spray would be to reduce that hardening and make it easier for the process so that you don't get dirty instruments when you're taking them out. Did that answer all of your guys' questions? Okay. So the whole point is to basically use a specific cleaner that is designed for ultrasonic use only. So a lot of people have used tablets. I don't know if that's what you guys use, but the tablets typically kind of don't disintegrate as well, and people end up scrubbing a little bit more than they have to. I don't know if you guys have tried this, but I can leave some samples of this. This is designed specifically also for Cavitron inserts, so it's safe and will protect your Cavitron inserts so that it won't, a lot of people find that this will get gross or it rusts or anything along the way. This will actually shine your instruments the more that you use it. I can leave you guys a few samples to try it. Have you guys been putting your Cavitron inserts inside of your cassettes?
They're in a cassette. I was going to ask you, what do they recommend? Do they recommend you putting them into the ultrasound?
Yes.
We don't.
Okay, so basically, again, with those guys, I like the reactions. It makes me happy when I get reactions.
Brand, like the U3D swivel, like those are specifically designed to go in.
Yeah, so basically when prior to these laws coming out, we would just say wipe them with alcohol, but don't scrub them, but do this, but don't touch them in this way. And that really wasn't in compliance with the law. We need to basically be telling you things that the law is telling you to do. And the law tells you to never manually scrub anything. So in order to not manually scrub anything, we have to put into the ultrasonic to remove the physical debris. So they tested it with this solution. This is what Dentsply recommends for this. But liquid-based is really the way we want to go. This will protect them. We've tested them and studied them. And I know it's very scary because people have been told for years and years and years to not do anything with your Cavitron inserts. But it was really...
The rep came to our office and said it's going to ruin the plates.
The
but-
stacks.
The
Yes,
stacks. Yeah, I think Dentsply probably told you that forever, right? Since the inception of inserts. But that's not really okay anymore. Before people would tell you to put things in cold sterile, and now nobody can tell you to put anything in cold sterile. So they have to change the way, they have to move with technology and basically make sure that things are safe for you. I am the Dentsply rep. Don't talk to me, talk to him. I'm just kidding. If there's a problem, but there is no issues with them going into the ultrasonic, especially since you guys are putting them into cassettes. There will be no harm with them. You typically, the stack warping will come during the sterilization process and not during the ultrasonic process.
Does that go along with like a Mealy, like a sanitizer or a Hydron? You can put those in the Hydron as well.
Yes, yes. It's even better. It's safer. Ultrasonics, dishwashers are, the top of technology. So those are going to be the safest for all instruments and inserts moving forward. I think that that's kind of the direction that they're moving in, especially with cassettes. So the cassettes are safe for you guys, and they're also the safest option for your instruments. So we just don't want anybody touching them. So a lot of the issues when they came to the Cavitron and why they've been studying is that people would take an alcohol wipe and it would basically go like this, or wipe it like this and then put it into the pouch and sterilize it. And basically this alcohol constantly rubbed onto this was causing it to become brittle and break and have all kinds of issues with it. So that's kind of where they've stemmed from. Those are not really wet, so don't think that I'm injuring myself. Does that make sense to everybody? Okay. I think that you guys are all, about all the different Cavitron options. I can pass this around if you guys want to see the other ones. But everything should basically either go disposable into the ultrasonic. If it's a handpiece, it would go into a handpiece machine and then into the autoclave, or straight in oil purge and goes into the autoclave. Does that make sense? Okay.
What's a handpiece machine?
There. I shouldn't have said that. I don't know what the name of it is. Do you?
I just
The thingamajigger.
drew a blank.
It's a specific machine designed for hand pieces that will do everything manually for you, so you don't have to do it.
Just the mechanical cleaning part, then it goes into the sterilization?
Yeah.
Okay.
It oils it, purges it. It
Automate that.
Is it water?
Automate.
Is it heat? Is it spray?
there's
Is it-
oil and spray. Yeah.
That's oil.
Does not sterilize it. No.
Speeds and slow speeds, just to get them ready to, so that,
So you don't have to do it manually.
and then you put it back in the cassette, then it goes down to the.
Yeah. Thank you.
We're working on that. We have the enzyme spray, like we have the little black pieces.
Okay. Does anybody else have any questions on that? I don't know where we got on ultrasonics. That's where we were. So then we basically take our cassettes, close, and then we're bringing them to the central sterilization area, right? And in that central sterilization area, do you have a cold sterile?
No. We don't use any cold sterilization.
Good. You should not use any cold sterilization. We do not want to use any cold sterilization. All right, so basically in that area, you just have an autoclave?
Four of them.
4.
And biohazard bins where they put their instruments into.
Statum.
No, instead.
Yeah, statum.
And what?
Statum.
A statum? Okay. 2 statums. And you're mostly using the statum for the hand pieces and the cassette?
XCPs, really.
XCPs. Okay. Interesting. Never heard anybody say that as their answer.
They hold so few things.
Yeah, that's why most people put their hand, it was designed specifically for hand pieces. And that way we are putting them into the statum and then there's not like a whole bunch of other stuff laying on top of them to ruin them, right? So when you comes to the XCPs, are you digital? Okay, so ideally we put a barrier sleeve over this, then we put this into our XCPs, right? Like this. So when we take this off, you're sterilizing these 3 pieces, and then they're kept in a sealed pouch until open in front of the patient. Yes. Okay. Make sure that when you're sterilizing these things, you do not put this hot metal rod directly on top of this not as hot plastic to cause it to melt, right? So a lot of people do this, and then I'll get these rings back with lines through them, and they're like, I never put the ring on top of that, or the arm. And I'm like, okay. What? Or the bite block, yeah. So does that, well, you can put it in the same bag, just kind of like next to each other and not like directly on top of each other, if that makes sense. Okay, so everything that goes into all of the autoclaves are in a sealed pouch, correct? Okay. So when we are using a sealed pouch, do you guys do it, or is there a designated person that does it? Students do it. This is the most ridiculous pouch you've ever seen, but I'm going to use it for my example. This is the pouch. There's a perforated line on the pouch. It needs to be folded on that perforated line. It cannot be haphazardly folded to anywhere where the instruments are, because if you are pouching it like this, you are not sterilizing it properly. We can stick our finger inside of there, and that makes it not sterilized properly, okay? When they're taken out of there, they have to be made sure that you can look for the sign to make sure that it actually goes off, because if it goes out into central, it goes back into play, you're using not sterilized instruments. Make sure that they are not stacking them on top of each other. They should be like this and not like this. Do you guys have a Tuttenauer or Midmark?
One, and we have a MagnaClave, that's basic.
Okay,
Cassettes.
a MagnaClave.
We have one mid-mark.
Midmark, okay. Because they basically, the CDC says for pouching, they say refer back to the manufacturer. So Midmark tells you one way, Tuttenauer tells you another way. I have no idea about that other one.
It's a big one.
Yeah, do they tell you which way to pouch? Plastic up, paper down? Oh, you're doing it this way. It is horizontal, but nobody's ever has those machines to go horizontal. So people always end up, paper or plastic.
Our pouches are not the paper plastic.
They're the
reusable.
wraps?
The cassette, you mean, the cassette
Yeah,
pouch,
the
yeah.
cassette.
Okay. Oh, because she said dump it out, so I assumed that it was pouches before.
They're pouches, but they're reusable. So they're like, they feel like canvas on the outside, but they have some type of plastic in between.
They're like a wrap?
It's, yeah.
Like a has a Velcro to
It's good for 200.
There's a
cycles.
Velcro strap?
No, not Velcro, there's a
but
flap that they
it's a
fold over,
flap
and
that
they
comes
tape
down.
that closed.
And that's where the indicator is on the tape? Okay.
And there's an indicator in each cassette.
Okay, perfect.
But
No,
there's
you're
no tape on the outside that just tells us it got exposed to heat.
Yes, but the indicator on the inside.
Each instrument.
Yes. And you guys are spore testing once a week? Okay. And then somebody has the results, obviously. We forgot to go and sterilize your room. So in order to sterilize the room properly, does all of the students know what the kill time is on the product that you're using? And does anybody know what kill time means when I ask that question? You're shaking your head like yes? Okay, so tell everybody.
Ours is a 2-minute.
Yours is a 2-minute. Okay, and what's that mean?
So clean, discard, and then disinfect, and then you leave it sit there for the 2 minutes in order to kill everything that is on the
Yeah, so
skin.
TB,
That's a kill time.
so TB is the kill time that you're looking for. So there's a lot of marketing that sometimes goes along with wipes that says like 30 seconds or, you always have to look for the TB kill. So if your TB kill is 2 minutes, it means you have to take one wipe out, you have to wipe all of those surfaces down, you throw that wipe away, and then you take another wipe out, and that's the disinfecting. So we need to make sure that we're cleaning, and then we're also disinfecting, okay? So we're going to kind of just stay in the room for a little bit. They're going a little bit out of the order that I normally do. But have you guys heard about these recent studies that have been coming out in the dental field when it comes to lung diseases? There's been a lot of lung diseases that have come out that basically is for asthma or some cancers that are all kind of associated back to the environment of dental because of the aerosols in the air. So when we were wiping down the room, we'd always say it's a 5-foot radius splatter zone. We have to make sure that we're wiping everything within that 5-foot radius splatter zone. But they've actually shown that it's expanded way further than the 5-foot radius. So they've trying to control the aerosols that you guys are breathing in. So there are kind of like 2 ways that they've gone about doing that is one is the masks that you're using. And then also there's been something that Dentsply has been working on, which is basically controlling the aerosols before it even is something that you need to be breathing in. So when hygienists are typically working, they will have a low speed suction in the patient's mouth, and then they'll have a mirror, and then they'll have whatever instrument that you're working with. This particular product is a high-speed suction that is basically a mirror and a cheek retractor. So it can do all of that so that you're not having all of those aerosols spread in the air. So you basically can do two-handed dentistry without having just that low speed sucking up the water. We're actually controlling the aerosols that are flying in the air so that we don't have to worry about these lung diseases that are caused.
This one is German made, right? It's made in Germany.
Yes.
We used it in Mexico.
We were at the dance club. We were at the dance club.
You were. Did you try it?
Yeah, they just came out with it.
It was very fun when I got to practice with it because they gave us the low speed, they gave us a high speed, and then they gave us this. It was so basically this is what you would. It kind of goes in. It goes into your high speed suction, and then this is what you use, and then you basically can use this the whole entire way. Yeah, you pull that back with your cheek. It will suck up everything, and then you'll be able to see.
I was gonna say, why didn't we put it still in the, that's why, yeah. Because they had just invented it.
Invented
We
it.
weren't allowed to disclose.
Yeah. And then, like when your doctor comes in to do their check, you just pop that off and they can use it as a mirror so that you don't need to get another mirror out or anything in private practice. Does that make sense, everybody? So we're really just trying to reduce the aerosols for you guys to be breathing in. And with that being said, you guys know about the mask ratings so that they're protecting you with the mask. So this ASTM level on here, everybody knows the differences. I put it. No. Okay, I'm like, I got half the room. So basically, before when you purchased a mask, you would say, I like that blue mask. I want a cone mask. I want a pink mask. My skin is sensitive. I need a sensitive mask. But it was just kind of picking and choosing out of a magazine. Now they basically took all of the masks and rated them for protection. So there's a level 1, a level 2, and a level 3. A level 1 is considered an exam mask, which really nobody should ever be using because we need something to be protecting us from aerosols. So level 2 is be considered moderate, and level 3 is recommended for oral surgeons and hygienists. So obviously the higher the number, the harder it is to breathe through, but I'm like, some people will put on a level 2 or a level 3 and be like, oh, this is fine. And some people put on a level 2 and still feel like they're suffocating. So you guys can pass these around, Vanna. You love me. And just to be able to try and feel the difference between being able to, you really should be using at all times a level 3, but if you are dying and you can't breathe, then go to a 2.
And that's marked on the box.
It will be marked on every single box, the ASTM level. If it is not marked on the box, that means it does not achieve a level 1.
I think we have to.
Does that make sense to everybody? Okay.
Versus 3.
Okay, so when we're wearing, can I have one of those masks, please?
No, you cannot.
So when we're wearing a mask,
Yes.
we put on a mask like this. We have the metal tips over the tip of our nose. We have the ear loop tags on the outside of our face, and then the pleats will be facing down. Oh no. John, defect. Does that make sense to everybody? Pleats are facing down. We're reflecting everything off of our face. Most people put them on inside out, and we're sucking in. Okay? When we're wearing a mask, it goes into this position, not this position, not this position, and not everybody's favorite home base of this position. Because according to the personal protective equipment, so this is OSHA, OSHA says that you need to be provided with a lab coat, which we'll talk about, masks, gloves, and protective eyewear. So if we have cuffed and covered here, the only area that is exposed is our neck. So if we take our mask and wipe our neck clean, we're just basically sucking up somebody's saliva into our mouths, okay? So we should be changing our mask between every single patient, okay? What did everybody try on? Are you dying?
Yeah, it's definitely different. You can feel
The protection.
You feel the protection? Yeah, feel the lack of air. I put on a level 3 too, and I'm always like, I should pretend mine is a 1 so you guys don't slip a 1 for me. All right, so when we're let's talk about the rest of the personal protective equipment that we should be wearing. According to OSHA, we need to be having a lab coat on with cuffed and buttoned. So when we come into the work, we're supposed to be wearing our personal clothing. We're changing into our scrubs while we're here. We're putting our lab coat on, whether it is cloth or disposable. We're taking that off during lunch, putting it back on after lunch, and then getting a biohazard bag and putting that lab coat into a biohazard bag, and having that picked up by a launder service that laundered on site and going home in our regular clothes. Okay? So that could be disposable or it can be reusable. OSHA does not care, but everybody in the environment has to be wearing that kind of coat, similar to what that lady's wearing.
So, in our preclinical setting, the first semester, right, they're working on each other. So they're learning the instrumentation and they're all wearing a cloth EPC, you know, the way you said it. So they'll usually, from what I see, wearing it about a week. It's kind of going into their locker room. I definitely will assume, I know they're not wearing it one day and then going home, washing it, coming back the next day. We don't have a laundry area here. So what's your take on that? Again, we're not working on patients,
also
even though
not-
they're each other's patient.
They're also not employees.
So what is
So
your take on
that's
that?
where the college comes into play with saying that how much they're gonna pay for it, they're not considered to be employees.
As a scene, like once they get into clinic, they're in a paper gown.
Yeah.
It's disposable. In a
Um,
preclinical setting, they're not. The cloth.
I think that between us, that cloth is just because we've been doing that all these years, that they, instead of having them buy lab coats for 107, we had them have these little lab jackets. I think it's probably antiquated and they should be wearing.
But there's no aerosols. Is there aerosol?
No.
No, not really. They cough and sneeze on each other, but,
Which they can do
right.
anytime.
I think it's hard to say because this is clearly a different environment
Yeah.
than private practice.
Yeah, so I think that, I don't know if
Whatever
there's,
Brooke says goes.
I was like, that's very specific. I'm not sure. I don't know.
Because you said a red bag, it just sparked.
Yes, because like if they're,
They have to put it in a red bag and then they take it home. Is that without?
no, they can't take it home. You guys have to launder it
Yeah.
or it laundered on site.
Wouldn't it be better off with disposable, like
That's
Sandy?
what I'm thinking, just
Just
do
start
away
the
with the
disposable
white lab
sooner.
jackets, they have to wear their regular
It's probably
disposable
expensive,
jackets.
that lab.
Yeah,
They really wouldn't have to wear them for radiology because they're
Disposable
working on
lab coats
mannequins.
have to go in biohazard?
no,
They go in regular trash.
yes.
On the mannequin.
The biohazard thing is a very, because a lot of times, like, you have to have a biohazard a sign, sticker on garbages inside of offices, but then when you take it out and you throw it in the garbage, it's no longer biohazard. It's very, I don't know the answer to that question, though. Sorry, I don't want to tell you something that's not right.
There are garbage cans supposed to be labeled with biohazard
Inside of the operatories?
inside the operatories only.
And anywhere that there would be gloves or a mask thrown into, they need to have a biohazard bag.
Because they
Um,
take their own
garbage.
bagged garbage and put it in a bigger receptacle.
Yeah.
They take their own little garbage that's already bagged
Yeah.
and put it in thing. That's fine.
Is there a biohazard sticker on the garbage in the room?
In the
And
rooms.
then
Oh.
No,
That little
No,
garbage
we
can?
need- no.
that needs a
or
sticker.
the big, the
Or the
big
big.
doesn't even have.
All of them need a sticker.
It has
At
biohazard
the
on it.
hospital, we have
They
biohazard
can't
That's
take
at
gonna
the
be an issue
hospital.
with.
But those-
That's only
Because
for,
what are the
like,
calls
if
gonna
you
do with
can
biohazard?
express blood out of.
That's
it,
for the
like,
bags specifically. They don't need to have red bags in their room. They just need to have a sticker that alerts people. I'm sure that if they're red, they do.
There's bio bins,
Yeah.
but our regular trash can, which all of our dental stuff goes in a regular trash can.
Doesn't have a sticker anywhere.
and-
That's an OSHA thing. I don't know.
I
You're-
never heard that either.
But
Yeah, I
yeah,
always thought the
hospital
same
makes
thing.
sense though, because you.
Because they want to basically make sure that nobody goes and sticks and, yes, housekeeping, a random thing that falls in there, they want to make sure that nobody puts their hands in there.
That's true.
That's true too.
It doesn't necessarily mean it has to be discarded in a
Discarded
different
that way. It's just
No.
an alert.
Just to
It's just
alert
for
them
handwriting.
to
It's just for alerting
The
random people to not put their hands inside the garbage. Yeah, and then it goes into a regular garbage. It is what it
Makes
is.
sense for those bins too.
Yeah.
The rubber bins.
So And then protective eyewear, everybody needs to have protective eyewear. And then treating our hands, we should be walking into the room before every single patient and treating our hands with an antimicrobial soap or an antimicrobial sanitizer so that they're basically like, watch me wash my hands, you seeing me wash my hands? So that we don't have anybody say, would you please wash your hands? We are making them aware. And it has to be with an antimicrobial, either soap or sanitizer. Okay, you can try this. No problem.
I think our afternoon faculty have to.
I was going to say, I was trying to steer. I was like, finish fast. Any questions? I didn't go over suction, but no?
I'll stay for section, yeah.
Okay.
I'll stay for section.
It's a very exciting subject.
Does anybody have the sign-in sheet?
Yeah, it's right here.
Oh.
It's right here.
Gosh. Wearing a mask. It's gonna smell too. Thank you.
It'll smell like baby powder soon.
Oh, it smells good.
Yeah,
Okay, can I just get that?
of course.
I'm coming right back. I just got to, they're thinking it's ready to start.
Okay. Yeah, okay, of course, no worries. Of course, of course. Good seeing you too.
I'll be sending you a note for the meeting in March.
Okay,
If you want to come to the product round.
okay,
You can, right?
bye.
Thank you for
Of course,
Great.
bye. Of course.
It's like not your regular. It's got a little bit of
Yes, please. Lots of things happen. It moisturizes better than Vaseline Intensive Care Lotion, so it's very nice on your skin.
moisture, sure.
Was there something that I didn't go over that you wanted me to go over?
I think you covered it all.
said suction?
Yeah, I just want to make sure that I covered everything else that you wanted me to have
I
covered.
do have a question.
Okay.
About if they're in the cubicle here, or in a dental operatory in a private practice, and they're going to take that cassette that has contaminated instruments in to the sterilization area, how are they transporting it?
On a tray.
On a tray. So a tray is fine
With a closed cassette, yes.
with a so it's already bagged. Or the cassette is, no, okay, I'm
Or
thinking
it's
of what we're
bagged.
doing.
I was like, what?
Because they bag them chair side, they do everything chair side
Yeah,
here.
but moving forward, you won't
Moving
be doing
forward,
that,
so
yeah.
if it's a closed cassette, they put it on a tray and walk the tray.
Yes, and theoretically, if you banged into me, or if I banged into you, no one is going to get hurt because those instruments are in a closed cassette.
Right.
But if they're an open cassette, then you would need to have something on top of that.
So I'm thinking a closed cassette, it's okay or not okay if you have a glove on, utility glove, to pick up the cassette and walk it to the sterilization. Because we're, as we're changing things, we're trying to think, how are we going to get these 24 people to pick up their cassettes and walk to the sterilization area safely? Some other schools have biohazard bins, they go around and they collect them chair side, so they're not actually, if you envision a private practice, they're not coming out of an operatory with something contaminated and
Yeah.
walking through a public area.
Yeah.
Not that you're gonna get a disease from walking through a public area.
No, but the whole point is more of like, in case somebody bangs into you or somebody trips over something. But the gloved is, they always say heavy utility gloves for everything. Heavy utility gloves can sometimes be more dangerous in those situations because you don't have a good of a grip on things. But gloved with a tray with a closed cassette is what they're implying.
So that's something we have to change too.
Why? Well, what are you doing now?
Well, now they're doing everything chair side. They've closed the cassette, they put it into the autoclave bag, they've sealed the autoclave bag, and now they're walking with the cassette in the autoclave bag to the prep room.
Just like holding the cassette, yeah.
Just an exam glove on
Yeah.
because the outside of the
Yeah.
Right, so that's what they're doing, but we weren't. quite
Yeah, the
sure.
only area which when they talk about gloves is like when you're working on a patient, gloves come off as soon as you leave that operatory, so you're not walking around anywhere. But that only exception is when you're walking directly to the sterilization area that you're wearing those gloves.
Yeah, because our rule kind of is you don't come out of the operatory with gloves on
Yeah.
your hands, and you don't go up to sterilization with gloves, because we don't know if they're
Clean or dirty,
contaminated
yeah.
or clean, but it's okay.
But if you're
as long as they're
holding
clean
instruments,
gloves.
yeah.
Where it's probably not okay to do the big heavy nitrile gloves to walk to there, because those
Yeah.
are not clean. They
That's
would
correct.
have to take off
That's right, they either wear a regular exam glove, or they grab paper towels and, they grab it with the paper towel, because I don't want their.
No,
hand
they should wear a
hands.
glove.
They should wear-
Just wear a glove.
Yeah.
And utility gloves is going to make it,
Oh, the utility
harder.
gloves
Well, they
are
just
dirty, so
disinfected
they're-
their
Yeah.
boots, so they're,
yeah,
then they gotta walk down
Yeah.
back.
So
So you're like, don't touch anything on your way back.
Yeah.
Because the prep room's in this corner, you could be over in this
yeah.
cubicle.
have to be delineated in exam glove, that's how you walk.
Okay.
I
Anything?
know the sharps container's always been, because I teach all the infection control, so I'm kind of savvy with some of these rules. So I always teach the ideal, okay, you know what I'm saying? But then I say, well, but here, it's kind
Yeah.
of like the laundry thing. Okay, what are you gonna do,
I know.
You don't have a laundry mat here.
Yeah,
It's the same thing with the sharps container. Ideally, should you have a sharps container in each cubicle, correct? So I tell them that, but here we are, we walk our sharps up to the prep room where the bin is. And again, somebody can knock into you and the sharps could fly,
yeah.
So
You
it's
can have
kinda-
like the small little bins in each of your rooms, like the small one. You just don't want people walking around with sharps.
Couldn't they carry a small one, like if they're gonna be giving local anesthesia, couldn't we get a small?
That's what they said, they do make little bins,
And
right?
they,
We
it's
used
part
to-
of their.
The little red bins. We used to have
They
little
bring
red
lots
bins.
of them.
The little red
They
sharps
were giving
bins.
local.
We used to
No,
have
we don't have
those.
little ones, we only have those big ones.
Oh, so they must have gotten rid of them. We used to have little
That's
ones.
since I've worked here, we haven't had those.
Okay.
The little ones were gone when I got here.
Yeah, we haven't had little ones in years and years and years. We've
Yeah.
always just had big ones in the prep room. Because it takes a couple of years for them to even get filled sometimes, right?
Yeah, we fill
Yeah,
about
and you can't
three.
empty it, once you
What?
put
Yeah.
a
Like
sharps
three,
in there.
one a
you
year.
empty it out,
One a
so
year.
that
Yeah,
won't-
about one a year.
leave it in
Because
there.
they have, the whole anesthesia course, they do a lot, and then,
Yeah, that could sit there for years. I mean, you think
Yeah.
about it.
Yeah.
Because we
Yeah.
don't give injections except
Yeah.
for that one course.
Yeah, no.
So those could sit in that, and you can't pile them all in, dump
No.
them all in. So
No,
that
you
could
can't.
literally be sitting there for
Ever.
years.
Yeah.
What, the small
The
ones?
small ones.
You can't open it and dump it into the big one, that's
Yeah,
what I was thinking,
right.
but then you can't open it.
Okay, suction? Sure. Do you guys run your suction right now? And how often do they do it?
after every clinic.
After every clinic? Okay. So that's like at the end of the day?
Well, they're in clinic all day today, so they start in the morning, they'll flush their lines at the end of the day today.
Okay. And do they each do their individual rooms?
Yes.
Okay, when you guys are teaching with the fluoride varnish, do they let people spit into the cuspidor or suck it up with the high-speed suction or low-speed suction? How do they get rid of the...
Well, they usually wear the varnish home.
I know, but
Yeah,
if
they
they're
don't
being
have to
dramatic, they spit, just don't let them spit it into a cuspidor or anything like that, right?
You mean the tray?
So
Tray gel.
are we using, oh, so we're not using varnish?
We do both. We do both.
Oh, we're doing foam and varnish on the same
Gel.
patient?
Gel and varnish.
Different patients.
Oh, I was gonna be like, that's a lot.
So they're taught as soon as they take the trays out, they immediately go in with the slime ejector to remove all the excess.
Okay.
Patient never does this, never does that.
Okay,
So they move the excess, then they ask the patient to spit out into the cuspidor as they push the button.
okay. What about with varnish?
Well,
If the varnish has, if the patient
has excess.
has excess saliva, they're probably spitting
Spitting.
in the cuspidor.
Okay, that's basically like glue being spit into the cuspidor, FYI. So like, I teach with like PureVac. PureVac is our evacuation cleaner. It's like, I don't know, you guys have heard of PureVac, right?
We used
Yeah.
to use that in my office, in private practice, we used Pure Vac.
Yeah, this is like the name brand, it's whatever. So I always recommend one pump of solution per quart of water per operatory, so you have a little to pour into the cuspidor too. Does that make sense? So they should be doing at the end of the day with the right amount of solution and water in each operatory without allowing for varnish to be spit in the cuspidor or using the saliva ejector, because you're going to ruin your suction lines if they don't do that.
Well, they do fill up a gallon container of our solution, whatever we're using.
Okay.
And they do a half saliva ejector, you know, just sucking up, and then the other half is poured into the customer.
Okay, just make sure that they're using the right amount of water and solution, because sometimes the people get like overly crazy about it, and the right combination isn't actually working. Less is sometimes more.
Yeah, I think we use too much in a gallon,
Yeah.
honestly.
It's a pump full, it says.
Yeah, but I don't think it's pumped to a gallon, it's a pump, I think you can make a big container and,
Yes.
and share it.
Yes.
But it was just easier because if you start measuring things out, it just, for efficiency purposes, it was one
Yeah.
pump we gave
But just
everybody.
make sure that they're like, it's not combining and not diluting and not actually accomplishing anything. That's where the talk is really about. Anything else?
Good.
Okay.
How about, do you talk about the water?
Water lines
Well, yeah,
for like Legionnaires.
yes.
Are you guys doing anything for your water lines right now?
We will be in.
Well, we haven't been doing probably everything we're supposed to. We've been treating the water lines. It's a sealed.
With the bottles? With like a tablet?
Yeah,
I
the
see
ADA tablets.
What?
With the ADA tablets,
Okay.
yeah, yeah.
Okay. That's,
But we're going with something.
you're doing like a straw?
We're doing a.
Dentapure.
Yeah.
Dentapure. You should do Dentapure. It makes it easier. Then you don't have to worry about it. But that doesn't take away from having to like purge the water line. So like for Cavitron or for like high speed or anything like that, you should be running those water lines for 2 minutes every morning.
But they did. That-
Yeah, because that's not going to take away from whatever's just sitting in the water lines. It's basically purifying what's coming in, but for what's sitting in, you want to make sure that that's being drained out.
They did that, yeah. They're told 20 to 30 seconds between patients.
Yeah, 2 minutes in the morning, 2 minutes at night,
Right.
30 seconds in between each patient. The morning one is like the most important one. Anything else?
Thanks.
Okay.
So we have a list of
Good
things.
information.
You know what?